Good day. It's certainly a pleasure to be back with you on the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat you're gonna be. How do you wanna be? Show me how you will be. How do you wanna be? Show me how you will be. Listen to the show, the more you'll know about your
And welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to this week's version of the Healthbeat Show. You know, we've been talking about a process called the continuum of care. And when we talk about the continuum of care, we've been talking about the fact that you start out in your own home, trying to prevent disease, you eat right, you try to exercise right, you take your vaccines, your vitamins, things of this nature. Then you go to the doctor's office. If you get sicker, you may show up in the emergency room through the continuum of care, be admitted to the hospital, maybe go to the intensive care or to surgery, and then you recover in the hospital for a short period of time. In the continuum, you then may go to a skilled nursing facility or to rehabilitation, and it is possible then for you to go home. Now, in this continuum, there's also another step, and it's called hospice. And we're here today joined by Mr. Mo Marlene from the Pro Health Home Care and Hospice Agency. And he's going to talk to us a little bit about what is hospice all about? Where does it fall within the continuum of care? Welcome to the Healthbeat Show, Mr. Marlene.
Thank you, Dr. Watson. It's a pleasure to be here, and thank you for having us. And looking forward to answering any questions.
Well, I think, you know, hospice is a big question. And first of all, if I were a patient, I'd want to know, what is hospice? And I am a patient, of course, as well. What is hospice? Is it a building? Is it a facility? Is it a program? Do you take someone and house them somewhere in a building called a hospice building? What is hospice exactly?
Well, doctor, as they commonly say, death comes to us all, right? Death and taxes are two things that are definitely certain. And often people don't make the best out of their lives. And unfortunately, there's a segment of your patients, of our population, that they will be facing a disease which is terminal, and they're suffering from it, and they come to a point where curative medicine is no longer an option, and hospice becomes an option. So what is hospice? And to answer your question, hospice is a service that can be provided at any location. It's not restricted to a hospital or a skilled nursing facility or assisted living facility or the privacy of your own home. So the location is based on the patient's functionality, the family's capability to cater towards the patient, and that's pretty much what the limitations are. But the hospice as is a service that comprises of skilled nursing. It also has medical social workers who attend to the patient's social needs and provides resources to a patient from perspectives of arranging transportation, arranging pharmacies for medications, and or funeral arrangements if they need to make so, an attorney for example if they need to make arrangements for their wills, and then home health aides who come in, who are also known as caregivers, who can assist patients in their daily activities of living, such as helping them cook, clean, give them a bath.
So you're really speaking of somebody who's dying. Right. A dying person is the person that would have hospice. Is that correct?
Well, yes. The determination, Medicare or the Department of Health, the coverage criteria deems this as if a patient is suffering from a terminal illness where a patient has 6 months or less based on the physician's judgment to live based on this critical terminal illness, that's when a patient would qualify for hospice. Now, the diseases can vary from a patient who's suffering from a cancer disease, or it could be a respiratory cardiac disease, it could be a neurological, it could be a dementia, it could be various types of diseases, so it's not restricted to any disease.
So even dementia is considered to be a qualifying disease for hospice?
Absolutely. I mean, there's very specific criteria based on the medical conditions, such as a patient's functional status. And when it comes to dementia or Alzheimer's, again, as I mentioned, you go back to that initial criteria, which is is the patient's life expectancy less than or equal to 6 months. And again, we can never know when a patient will actually pass away. Some patients where physicians qualify a patient who would live 6 months, 6 months actually don't end up living past a week or a few days or a few months, or in cases where you have patients who live beyond the 6 months or even a year and a half. As long as the patient's conditions are declining and they need that comfort care and that paid management and that support, they will continue to qualify for hospice. Obviously, there are certain assessments and evaluations that go into the whole process.
So you're saying pretty much it's somebody who's dying, maybe has less than 6 months to live.
Right.
You're giving comfort care, all kinds of support.
Right.
You may help them put together their will, or an attorney is
Right.
involved, pain management, transportation, and then there's some other things, spiritual support.
Right.
Because that whole process of transitioning
Right.
is a spiritual one, and many people, are very uncomfortable about the fact that this may be the end of life.
Right.
Who decides when a patient goes into hospice? Is this something that the doctor decides? Can the patient decide on their own? How does one get into such a program?
Well, definitely at the end of the day, the referral has to come from a physician. A physician would have to, the primary care physician or the attending physician would need to certify that the patient medically qualifies and fits the criteria. But for those that are watching this show, or perhaps someone at home, from speaking to your physician, your medical condition or where you stand today, whether you're at a hospital or whether you're at a nursing home or whether you are in a skilled nursing facility, whichever that may be, you know what your medical condition is. And hospice is about living. You know that you are going to be dying or reaching that end stage, and we're not here to remind you of that fact. We're here to remind you how to live the last few days or weeks or months of your life. Especially when someone is dying, when someone is reaching that end stage, it's utter chaos in the family, at the patient's home, in your mind. Exactly. So we help you organize your thoughts, help you provide a platform of support, not just for you as a patient, but mostly for the family as well. Because it's usually the families who suffer from the after effects of someone passing away. And we provide that spiritual and psychological support for the family even for a period of 18 months after the patient passes away. So it is a
So it helps the family also, not just the patient.
Absolutely.
Okay.
Absolutely.
We're here with Mr. Mo Marlene. He works with an organization known as Pro Health Home and Hospice Care. And we're talking about the whole concept of living the rest of your life, and particularly the last 6 months of your life. Stay tuned. We'll be right back.
Have a good night and rest easy.
Are you tired, sleepy, depressed, snore a lot, sleep a lot during the daytime? Do you have high blood pressure, diabetes, or suffer from sexual dysfunction? You may be suffering from sleep apnea. Talk to your doctor and contact the James A. Watson Wellness Center Sleep Clinic. Remember, we want you to have a good night and rest easy. Give us a call today at 510-444-8627. Remember, that's 510-444-8627, and you'll rest easy.
right back here at the Healthbeat Show. I'm Dr. Jeffrey Watson, and with me is none other than Mr. Mo Marlene. He is the president of Pro Health Home Care and Hospice, and we're talking a little bit about hospice. Now, Mr. Marlene, you've told me that this is a program. It's not necessarily a facility,
Correct.
but you can have this care within a nursing home, within your own home,
Right.
also, I guess, even within a hospital, too.
Yes.
And it is for people who have, their doctor has determined that they're in the last 6 months of their life,
Right.
and it's to help them live.
Right.
It's really to help
Absolutely.
them be comfortable. Now, I have a question, and I don't mean to in any way be derogatory, but I'm sure that some of the viewers are wondering, is this a Dr. Kevorkian type of process? I mean, here we had a doctor who became very famous in helping people to die. I mean, he gave them medicines and theoretically made them comfortable. Was that whole approach a hospice approach in your mind?
Well, Dr. Watson, as you see, a lot of things that are going on in the healthcare industry, a lot of concepts are misunderstood by many individuals, not just patients, but also especially healthcare providers. If hospice was in fact something that does hasten the death, obviously it would be against laws and all regulations. The misunderstanding is hospice something where you just pumped patients with these medications where it quickens the patient's death, and absolutely not. We're not going to be
That's
providing...
not the goal of it, is to
Absolutely not.
to do euthanasia or
Absolutely.
to help, take somebody out, so to speak.
Absolutely not. As far as I'm concerned, what I believe is in hospice, the actual symptom management, the pain management, the medications where the nurse comes in and provides you with your pain meds and or advice on your healthy eating habits and whatnot is only about 30% of what we do. The 70% of what we do is actually provide you that emotional and psychological and spiritual support, because you don't really care. If you're going to be dying, whether you miss one pill or one dressing, it's not going to make a difference. What's important is, are you really living every day of your life, the last few days of your life, the months or weeks, with your family? Are you able to really focus? And do you have someone to talk to? I mean, you have kids that are probably working.
Do you have people who pray with you during that process?
Absolutely, and we respect all religious denominations, and if there's any particular spiritual denomination that you favor towards, we have priests, rabbis, and if you're of Islamic faith, individuals who can cater towards those needs. So we're definitely respectful of individuals, especially as you mentioned, one of the things when people are transitioning to that next phase after life is they want to get closer to God. They want to be able to repent for the things that they've done and build that spiritual awareness in them, and that's part of the process. That's part of what hospice provides.
How is hospice paid for? I mean, this sounds like an expensive process.
Right.
Am I going to have to sell my house? Am I going to have to will it to you so that you can send these people to come take care of me and give me assistance with my will and help me to feel comfortable and stay in my own home and all that? How is it paid for?
See, that's the beauty about it. Hospice is a program that is 100% covered by, if you are a Medicare recipient, Medicare beneficiary, or a Medi-Cal state-funded insurance, which is for low-income individuals. It's a program that's 100% covered. There is no copay, there is no out-of-pocket expense if you are a Medicare or Medi-Cal beneficiary. There are private insurance programs that also fund the hospice programs, and you would need to particularly look into the coverage details of it.
Do you have to pay special if you, let's say you're a person that's not of Medicare age, not 65, and you have regular insurance, like let's say you had Kaiser or you had Blue Cross or HealthNet or something like that. Do those kinds of insurances cover hospice?
Absolutely. I mean, your most popular healthcare programs such as Kaiser, Blue Cross, Blue Shield, Aetna, United Healthcare, HealthNet, these are all insurances that have been around and definitely have adhered with the policies and procedures of Medicare and your state insurances. So yes, they are covered programs. As far as their coverage criteria are specific to their plans, but based on experiences, yeah, it's a service that is covered by insurance.
Now, here you're trying to help a person live the last days of their life, and you said earlier that maybe some alternatives. You will do things such as music therapy, maybe massage therapy, maybe yoga, maybe chiropractic. maybe some spiritual therapy, maybe persons would like to utilize herbal techniques like medical marijuana and things like this. Are those things covered in the process?
Certain aspects of it are absolutely. So as far as the reimbursements go, Medicare or the private insurance or Medi-Cal for that matter, they cover the hospice agency on a daily rate or perhaps on a monthly rate. And the rest of the services that are provided are part of what the company wants to provide. So our company, ProHealth, we believe that we want to go above and beyond to provide these supportive services for the patient. So first of all, we'll come up with a list of things that you always wanted to do as a patient in your life.
A bucket list.
A bucket list, exactly. You watched the movie as well. So what are the things that you always wanted to do? And let's help you accomplish that. Do you want to do your hair like Marilyn Monroe, or do you want to get your nails painted? Do you want to wear this?
You facilitate that?
Absolutely.
In that process?
Absolutely. Music therapy, as you mentioned, is one of them. Massage therapy. Maybe we'll have a volunteer just come in and talk to you. Storytelling sessions or book reading sessions. These are all. We have a great volunteer program where we have many individuals who understand the concept of hospice, and they've dedicated their time at no cost, with no charge at all, to spend time with these seniors who are at home, where their kids are away at work, while they're away at work, or families who don't have kids or loved ones to take care of them. So it's a full comprehensive program that is catered towards taking care of the patient, attending to the needs of the patient as well as the family.
Now, I mentioned, I threw in there the process of medical marijuana because that's a very interesting concept, and there are a lot of people who never would have utilized that, but let's say they have HIV or they have cancer and they need it to help them stimulate their appetite or rest or sleep or be more comfortable. But if they had Medicare, it's my understanding that federal agencies like that would not pay for the medication itself of marijuana type. But within the program, if a doctor prescribed it and the patient purchased it, it would be acceptable to utilize if it met the medical requirements and standards.
I mean, definitely, as I mentioned, we want to make sure we provide every aspect of comfort for this patient, and unfortunately we can compensate for those types of treatments due to federal regulations. But if the patient qualifies and the physician deems that it's something that's necessary, we can facilitate through for example, a medical social worker can facilitate it through a proper appropriate clinic if that's what the patient would want, and if that's what would definitely mitigate the patient's pain and or increase their appetite. If it's something that the physician attests to, absolutely, we can be an avenue of facilitating such a service, but due to federal regulations, it's not something that we can compensate for.
Okay. So, all right, we're here with Mr. Mo Marlene. We're talking about the whole concept of hospice, about living the rest of your life. He said, make your bucket list out, a great movie, I saw it, and help you to enjoy those last aspects of your life. We'll be right back. Stay tuned. I'm Dr. Jeffrey Watson. We're right here on the Healthbeat Show.
But I heard if you have your health, you have everything.
Victory is mine, victory is mine, victory today is mine. I told Satan, get thee behind, 'cause victory today is mine.
All right, beautiful, beautiful. We're here with Miss Tranisha Golston from the 5 a Day campaign that tells you to eat 5 fruits and vegetables every day.
Right, that's right.
Because that's the key to our health. Now, we have some fruits and vegetables. What can you tell us about the seasonal guide to fruits and vegetables?
Okay, well, if you're on a budget, it's always best to purchase fruits and vegetables when they're in season. And I just wanted to point out a couple of our informational brochures that the state provides us with. And for example, in the spring, we're looking at between April and June, you'll find bananas, apricots, eggplants, these types of things that are in season. And say for example in the summer, July through September, you have chives, you have scallions, you have onions, you have blackberries. And I want to point something out on here too. Now this is a seasonal guide for fruits and vegetables for fall, October through December. We're looking at bok choy, we're looking at broccoli, and in the wintertime between January and March, we're looking at collard greens, which we have here on our lovely display. We're looking at mustard greens, kiwi fruit, tomatoes, and even red apples.
And that's when they grow or are most available during those seasons?
Yes, that's when they are in season, that's when they grow. And if you're on a budget, as most of us are, that's when it's best to purchase them. So you can make sure you have your 5 to 9 servings of fruits and vegetables.
And so what you're saying is that all year around, these fruits and vegetables, and a variety of them, are available to us.
That is correct.
No excuse not to get your good fruits and vegetables. That's what it's all about. Right here on Down Home Healthy Cooking on the Healthbeat Show. Eat your fruits and vegetables. They're good for you. The victory will be yours. Welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson, and we're here with Mr. Mo Marlene from the Pro Health Home Care and Hospice Agency. We've been talking about the continuum of care, going from your home to the emergency room to the hospital to being discharged to a skilled nursing facility, maybe home care, and if you have less than 6 months to live, maybe you choose to have the hospice program. Now, let's just go over one more time the rules of what would allow one to be in the hospice program and receive all the supportive care that allows you to live your life most comfortably during the last 6 months of your life. One is that you have to have a diagnosis in which the doctor thinks that you're not going to live more than 6 months. Is that correct?
Yes.
So some type of a terminal illness.
That's correct.
2, you have to make a decision that you're going to be a no-code blue. Is that correct? You're not going to get CPR or be on a ventilator or get shocked. You have to decide that, well, if God decides it's my time, then I will, go.
Yes, basically you opt to the option of do not resuscitate. You opt out.
And usually you have to sign an advance directive type form that says that you've agreed on that.
Right.
And 3, is it correct that for whatever the terminal illness is, that you make the choice that you aren't going to go to the hospital?
Right. Because it's a choice. Once you've decided to enroll in the hospice program, you've decided that the curative option is not something that will benefit you, and it will actually reduce the quality of your life, and it won't improve the quality of your life. So essentially, a part of the hospice program is once you've decided that you're going to choose the option of comfort care, you will not be pursuing hospitalization in reference to treatment for that particular medical condition.
But you can still get your treatments for diabetes and high blood pressure, asthma.
Absolutely.
Pain,
so for example,
anything.
the best example I can think of is if you're a cancer patient and you're enrolled in the hospice program due to end-stage cancer, obviously if you happen to have pneumonia or fall and break your leg or whatnot, or if it's medical conditions that's not related to your hospice medical diagnosis, you're definitely allowed to go into the hospital. And occasionally you have patients where their families watch their loved one breathe heavily, and it could be even related to the diagnosis, and you can always opt to go to the hospital, at which point you will be disenrolled from the hospice program. So it's not something where you're signed in and then you're done for life, that's it. You can always opt out.
So you can change your mind.
Absolutely.
It's not like, I got in this and I changed my mind.
Absolutely not, doctor. And in occasions we have patients where the symptoms stabilize and or they become better, at which point we recognize these symptoms and we consult the physician, of course, and then we move to a curative process.
Is there any kind of negative ramification as it relates to their insurance or anything? Does their insurance ding them or charge them something personally outside the insurance or anything like that?
Absolutely not. Call it reasons of God's miracle, or for that matter, a better immune system, or medications that were provided for comfort care which actually had a different reaction. Call it whatever you want. But the miracle of God is something beyond our ability to predict death, right? And in some occasions where physicians and an entire team of hospital professionals say that a patient will die in less than 6 months, 2 months into it, the patient actually gets better. And we're pro-life. We're not trying to, as we said, hasten anyone's death.
And hospice can be provided by a variety of agencies. It's not just one company.
Absolutely.
There are, just like there's a lot of skilled nursing
Absolutely.
facilities or home care agency, there's a lot of hospice agencies.
Absolutely.
So the patient then actually can have a choice in what company they want to choose.
Definitely. There's many companies out there, and I personally think patients absolutely need to explore these options and not be selfish, especially family members, because the best is still to come. You're still living. If you're alive today, that means tomorrow is a day that's better, which you have no control over. So take advantage of it and utilize these government and insurance covered services to exemplify your life and give you a better quality of life. Let these agencies, let us help you, do the things that you always wanted to. Let us help you live.
Now, if one were to decide that they wanted to utilize pro-health, home care, and hospice, how would they get in touch with your agency?
They would definitely call one of our representatives, and we can have a representative come over to their home and discuss options and explain to them in great detail on what hospice is. We typically send out a skilled nurse or one of our bereavement coordinators or one of our care specialists who can sit with them and provide them with all the material and discuss all options. So do
you have a number? You have a phone number for your company?
Yes, it's 408-451-9055. We also have a toll-free number which can be put on the screen and provided to all the viewers as well.
Okay, 408-451-9055. 451-9055. Okay, we're speaking here with Mr. Mo Marlene. He is the president of the Pro Health Home Care and Hospice Agency, where you can get actually also skilled nursing. You don't have to go into hospice. You can take people all the way from having home care as a skilled nursing agency,
Absolutely.
and then if they look like they had a terminal illness, they can be transitioned over
Absolutely.
into hospice, all as a part of the continuum of care. You've heard it right here on the Healthbeat Show. I'm Dr. Jeffrey Watson. We thank you, Mr. Mo Marlene. You're the first hospice person that I can remember us having.
Thank you very much, Dr. Watson. It's a pleasure and honor to be here, and we're here to provide a service, as you said, continuum of care, and that's part and parcel of what we provide.
All right, hospice. You've heard it right here on the Healthbeat Show. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth, and when you have your health, you have everything. God bless you. We'll see you next time.
You don't have to take my word. You don't have to take my word. Wanna be. You don't have to show